Okay, let's keep going. So we talk about the exposure treatment. Like some people have OCD, they always worry about they forget to turn off the burner. And exposure therapy is, okay, you go there and you sit there for hours, you watch the burner and you found you are fine. So that's the exposure therapy. Okay, substance dependent addiction. And addiction to drugs, addiction to alcohol. So that's the definition. It affects their daily life. That's addiction. And for addiction, we know a lot of their neuronal mechanism. In the NIH, they actually have an institute. They have the Addiction Institute. And then 10 years ago, they put the alcohol addiction independent because we have too many people in the American struggle with alcohol addiction. So there are a lot of fundings devoted to study the brain mechanism of addiction. So we know a lot of addiction. And we talk about this in Unit 3. In the brain, the nucleus accumbens, that's the areas, and associated with addiction. It turned out the dopamine, they use dopamine, this neuron use dopamine. And dopamine, that's the reward system. And this is why addiction is so difficult to quit, because that means we cut down your pleasure feeling. So we have a lot of people in the United States struggle with addiction. And nucleus accumbens, and also the other two areas, ventral tegmental area. That's the area produce dopamine, gonna release dopamine to nucleus accumbens. And it will also work with the area called the prefrontal cortex. That's the high-level reasoning, right? And it will control this part, so you have those impulsive inhibition. So you inhibit the brain area, make you think about the consequence before you do. And now all this being occupy your brain. Now you behave like an animal. You are looking for those addictive medicine, drug, alcohol. And when you get addicted, okay, two symptoms. One is tolerance. Your brain always try to adjust. So once you pour this kind of toxins into your brain, and your brain release the neurotransmitter dopamine like crazy, and your brain try to protect yourself because there's way too much dopamine, and they will try to cut down, means they will take the receptor back and cut down the feeling. And it turned out, okay, the next time you have to take more medicine to release the same amount of dopamine to make you feel that high. So you gradually increase the dosage, and that's because your body have the tolerance. The second one, withdrawal. That's when you decide, okay, I want to quit. Your body have the withdrawal effect. So two of them. This video show you, okay, we can train rat to do drugs. They would press the bar and put the drug to their brain like crazy. They feel high. So there's a lot of studies in animals. In alcohol addiction, drug addiction, they use rat to do the experiment. Alcoholism, that's one of the addiction. And we have two different types of alcoholism, type 1 and type 2. Type 1 is they develop gradually. Happens in both gender, male and female. Is while you drink one glass and one turn into two turn into half bottle, and half bottle turn into one bottle. So gradually increase. That's type 1. Type 2 is early onset. It's more prevalent in men and more severe in men. And we consider maybe that's the gene affected. Like, you know, this person is totally well in college, and after 3 years you met him, he found he turned to the serious alcoholism. And that's this one. What's the risk factor? Family history. Apparently, yeah, genes play a role. So if they have a family history, they have a higher chance. It doesn't mean they will have become alcoholism. It's just they have a higher chance. And also the development, right? So that's why we talk about the development. It affects a lot. They exposed to the parents' conflict. They don't have family support or abuse. And sometimes culture, like some culture like to drink, happen in some Asian culture. They like to drink, and they will affect as well. Okay, treatment. And I have to tell you, all these treatments very ineffective, high unsuccessful rate. So only about 10 to 20% are successful, and relapse very common. One is controlled drinking. So usually they drink too much. They say, I want to quit. Okay, they do the controlled drinking. They reduce their consumption. Very easy to relapse back. During the holiday, they will drink more, go back. Harm reduction is they completely quit, but their body can have the withdrawal effect. So it's very painful. Both of them are highly controversial and high relapse rate. Okay, now let's look at serious mental disease called depression. Depression is not like a heart attack or stroke. It cannot kill you. Depression won't kill you. But people with depression, they kill themselves. This is considered a pretty serious mental disease because they feel like there's no way they can get out of those miserable environments. And those bad things just keep happening in their brain, and eventually they kill themselves. So depression is considered a very serious mental disease. And depression is not you just feel depressed a few hours or a few days. It's called depression. They have the clinical definition. People with depression, they lose interest in food and sex. So think about this. In animal, their whole life, they're looking for these two things. And human, well, we are animal, which is more advanced. And these are the original desire. So if you are not interested in these two, means, okay, something is seriously wrong. And they feel worthless, okay, guilt and powerlessness, because they don't know how they're able to get out of those depressed moods. And psychology affects physiology. When they have serious depression, they affect their sleep pattern. So they can quickly go to the rapid eye movement sleep. So they will start to dream, and then they turn awake in the middle of the night. And when you affect your sleep-awake cycle, you affect your body recovery. So they look very sick, and also their immune system become weaker, and they get sick. So now their psychology really affect their physiology. So people with serious depression, they not just look depressed, they look sick. And they may attempt suicide. We talk about this. So in the sleep, there's the normal sleep cycle, and you take about 90 minutes, go through this cycle, go to the deep sleep, and go back to REM, and repeat the cycle again. And every night you repeat about 5-6 times of this. And people with depression or other disease like PTSD, they will quickly go to the REM and come back and awake. So it interrupts their normal sleep cycle. Let's look at what's the treatment. People with seasonal affective disorder. We do have people live in the cities. They have 6 months of winter. They have no light. And turn out in the winter season, more people commit suicide. And they think it's about the light. And it makes biological sense because we are not nocturnal. We need the light. So our sleep-awake cycle is totally associated with the sunlight. And also the sunlight to your skin gives you vitamin D3, so it helps. And they found light therapy helps some people. So if you live in the areas with little sunlight and you feel depressed, try this, the light therapy. Not too much. In Texas, we usually have too much sunlight. It can give you sunburn. It can give you skin cancer. It can give you wrinkle. Yeah, the sunlight can damage those elastic fiber in the dermis layer and can create the early aging of your skin. But every day is about 15 minutes sunlight. That will be good enough because it helps your body produce vitamin D3. And turn out the vitamin D3, your brain actually have vitamin D3 receptor, and it will help. It will help. And here we talk more about depression. Why is it so difficult to treat those mental disease? Not just depression, also schizophrenia. It turned out it's not one gene causes it. And in a mental disease, it's actually very rare we have one gene cause one disease. It's usually multi-genes. And when you have multi-genes, it becomes very difficult. You have to turn on gene 1, 3 at this moment, then turn gene 3 off, turn on 4, and turn off 6. So it becomes very complicated pattern. And every time we have the multi-genes effect, it becomes very difficult to treat because this person can be caused by this genes turn on and that genes turn off, and another person have totally different pattern. So depression, also schizophrenia, and it's difficult to treat them because it's multi-genes. Sex difference, gender difference. Before adolescence, equal command, but after adolescence, women are twice more. Why? Well, we don't know, but if you think about this, you may think, well, with sex hormone effect, right? And then the female sex hormones, let's look at the female sex hormone. And you say, okay, do they have, do the women with depression have less sex hormone? It could be. That's a good theory. Right? In chapter 2, we talk about the research methodology. If you look before adolescence, they are equal. And after adolescence, and now some women have twice chance. It's because those women have low female sex hormone. And that's a good thinking logic, but turns out it's not that simple. Apparently, before you, the scientists thought about it. So they think, well, okay, because the women start to have those big hormone change in their body, they have the menstrual cycle every month, their sex hormone level just change. Then if those women, because of their sex hormone level is low, they have depression, then let's give them sex hormone. But before we do that, we have to find, do they really have lower sex hormone? And turn out, no, it's not that simple. They do not have significant lower female sex hormone compared with non-depressed women. So it's more complicated than that. But apparently the hormone play a role. So what can trigger depression? Negative life events. Always something happen in your life. So little relationship, those people, they are loner and they have experienced big life trauma. This affect them. But it's not causation. It doesn't mean that you experience this, you're gonna have depression. It's always correlation, it's not causation. And we found people, they have bad life, they have little relationship, and they've been betrayed, or they experience their loved one die, and some of them are fine. Because it depends on how you interpret this result. It's always not those events, it's how you interpret those events. This one effect. Okay, let's look at the treatments. The treatments, first one, cognitive therapy. So you will talk with some therapists, and it helps in some people. Medication, okay, medication is SSRI. This is the medicines in 1988. 1988 is a big year. They found SSRI. Next slide, let's talk about how SSRI work. And before, in the mid-20th century, they actually use morphine to treat depression. Yeah, so when people feel depressed, you give them morphine, and they feel pretty high, and they feel less depressed, right? And in 1988, SSRI found. And after 30-40 years, we still use SSRI. And turn out it's very stable, works pretty well medicine. How they work? So after dopamine is released, so it's mainly dopamine, it will be taken back, and some of them will be cut down. So be taken back, you need the membrane protein, and SSRI is to inhibit this membrane protein, don't take it back. So it turns out you have more available dopamine to activate your neuron. And the other one is called MAOI, it inhibits this enzyme. So after they've been taken back, they will be disintegrated, recycled. And inhibit this enzyme, it will inhibit, you break them down. So both of them make more dopamine available during the synapse. So both of them works in some patients. And that's the antidepressants. Okay, let's take a break.